Welcome again. Today we're going to discuss a very interesting case that we've seen at American Wellness Center. And during this video, you'll see the actual patient and the parents' testimony to how we managed the case. So this case is what we call a mimicker of epilepsy. What are mimickers of epilepsy? Mimickers of epilepsy are cases that might look like seizures but are not actually seizures. It could be in the form of movement disorder or a hyperexcitable state. This patient was diagnosed as having epilepsy and started on anti-seizure medication before we saw this case. Upon arrival, we could clearly see that there is family history of similar movements, and at the same time, the response to anti-seizure medication was not very clear. Upon physical exam, and you'll see that later in the video, I could identify that whatever this child was having was a case of movement disorder or abnormal movement in the form of hyperexcitability called hyperekplexia. This case is genetic disorder whereby the child becomes hyperactive or hyperstimulant to any of the surrounding environment or stimulus that might be given, or even as simple as just touch. We managed to confirm this diagnosis, and you'll see that we even did an EEG. And after the EEG was found to be normal, the physical exam with the history confirmed the diagnosis, and we stopped the anti-seizure medication and started him on the right treatment. The EEG, as expected, is completely normal. This really confirms the diagnosis of hyperekplexia and not epilepsy or seizure. So now the plan is to withdraw the medication and stop it, the anti-seizure medication, and place on another medication that might help in this condition, and hopefully by the age of 1 year, all the symptoms will go away and we'll stop the medication.
Hi, my name is Shiraz. I'm father of Halima Shiraz. She was on birth. On the second day of birth, she had seizures as per the doctors. Then she was transferred to over there. They gave her medications, and the neurologist over there recommended that she should be on anti-convulsive medicines like phenobarbital. From hospital, after my baby got discharged around 10 days, the doctor head over there, he referred me to Dr. Ahmad. He's a pediatric neurologist in American Wellness Center. So he's currently looking at my child, and he has been very supportive. And as per him, if these are not like seizures or epilepsy thing, which was very like assuring for us and very calming for us that our child is not having seizures. And we were afraid when we discharged our daughter and went at home, and we were afraid that what happens if she has seizures again. But when we visited Dr. Ahmad here in American Wellness Center, he analyzed our daughter, and he found out that these are not seizures, and these are something different, hyperlexia, in which child is hyperactive and it looks like a seizure, but it's not a seizure. So since that day, it has been like very confident for us, and we are able to take care of our kid more well and better. So thanks, Dr. Ahmed.